So when someone develops facial paralysis, the first thing everyone's worried about is whether that person had a stroke. So what is a stroke and what's the difference between a stroke and someone who gets Bell's palsy or some other related facial paralysis? So we call this a stroke a central facial paralysis. So the brain, the way that the smile works and the facial movement work is we have the brain that generates the signal. That signal is given off to a wiring system called the facial nerve. And the facial nerve then leaves the brain and goes into muscles of facial expressions that act upon the movement that's generated by the brain. So anything that impacts the brain matter itself is called a central cause of facial paralysis, and that's what a stroke is. Whereas anything that impacts the nerve or the musculature is called a peripheral. So how do we tell the difference, and why do you have to go to the emergency room to make sure you don't have a stroke? One of the most critical components is because there is some cross collaboration within the brain to the facial nerve, people who have a central facial paralysis, such as a stroke, still keep the movement of their forehead. They may have a drooping of the face, but their forehead keeps moving. So that is one of the ways that an emergency room physician, primary care doctor, neurologist, ENT, or a facial nerve expert will be able to tell that you have had or have not had a stroke. Someone whose nerve is fully engaged in a paralysis, the entire face will be paralyzed. That's what happens with Bell's palsy, Ramsay-Hunt syndrome, or other causes that impact the tumor and nerves behind and before the nerve starts going into the muscles. So peripheral tumors, peripheral viral inflammation, peripheral trauma results in very, very different scenario than a stroke or some sort of central paralysis.